Yeah, so he got NHS interview question on the Wednesday, 22nd of January, and he sent the structure of the interview. So we need to go through this together, and from what they have here, I will be able to draft out questions and give answers to it. I've been so busy, I'm not able to come out, sit down on the camera to do this. That's why I'll be using different clips of my videos from my trip in Qatar to voice over this. So now let's get started. So he said the interview will begin with an opening question that aimed at understanding your motivation and passion for healthcare. Now, they have competency-based assessment. So the next interview will delve into two competency-based questions. This question will evaluate your ability to demonstrate relevant behaviors or skills in accordance with the organization values. So what is the organizational values? What are the values? They should list it. Go and check where you applied the job from. Every job advertised, that organization have their values, so the trust values. The second one, they will have scenario-based evaluation. So finally, the interview will conclude with a scenario-based assessment presenting two real-world situations to the candidate. One scenario will prompt you to verbally outline the steps you would take to resolve a problem, assessing your problem solving and critical thinking skills. The other scenario provided in the candidate review preparation pack attached involves a role play scenario with an angry patient. One of the panel members will act as the patient, delivering a statement for you to respond to. So they want to do this to evaluate your ability to handle challenging situations effectively. Now they have scenario-based assessment, role play scenario. In readiness for your interview, please think about how you would react and deal with this situation. You have applied as a healthcare assistant, so you are working as a healthcare assistant at their hospital, and a patient on your busy ward seems very frustrated. They are swearing, shouting, and appear visibly distressed. Other patients are also becoming upset with the noise and situation. The patient had been told they could be discharged from the hospital around 11 a.m., but it is now 12:30 p.m. The patient needs to be checked over by the doctor before they can safely be discharged and go home. The doctor is currently occupied in the ward next door. The patient yells at you, and this is unacceptable. They tell you they will walk out of the hospital themselves and will be making public complaint if they do not get discharged very soon. I should help. Okay, so I will start with the introduction and motivation assessment. From all these things I've read, I'm able to come out with this. Now listen, when they ask you about your motivation and passion for healthcare, remember, before you applied for this job, something inspired you, yeah? So you have to focus on what inspired you to pursue this career. What are those things that can inspire you, such as personal experiences or desire to help others? Share your dedication to making a difference in patient life and contributing to healthcare field. Remember, I said this type of assessment or interview, tell them a story, your personal experience, somebody you have cared for. I have cared for my mom when she was sick, my dad when she had stroke, my grandmother when, tell them story. I'm still coming to that. Now we go to competency-based assessment. For competency-based questions, you should be ready to provide examples from your work experience, your education, or your personal life experiences to demonstrate your ability to show examples of the organizational value. I would advise you to use STAR method to structure your answers. Describe the situation, describe the task, Tell them your actions and results of your choosing example. Now, scenario-based evaluation. They want to check, one, your problem-solving scenario. You have to, after acting that, you have to outline the steps you will take to address the problem. You have to consider the factors like, the patient safety, communication, collaboration with other healthcare professionals. For example, you might tell them you need to assess patient's current conditions and determine if their discharge will be safety. Communicate with the doctor about the patient distress and the urgency to be discharged because they want them to be discharged immediately. Yeah. Offer comfort and support to the patient. Acknowledging their frustration and assuring them that you are working on resolving the issue. Monitor and manage the reaction of other patients to maintain a calm environment. Work with the healthcare team to ensure a smooth discharge process once the doctor is available. So when they will pose that scenario-based this thing to you, the patient was being aggressive, they want to go home, the doctor was not there. They want to assess your problem-solving skills. Okay? I just listed what you can do, but I will still say something there. Let's calm down. Now, role play scenario. In a role play scenario with an angry patient, you have to focus on, first of all, active listening. I used to say it, when you have a resident who is agitated, they are doing something funny, what do? Pay attention. Listen to them. Empathy, not sympathy. Use empathy. Okay, you have to acknowledge their frustration. Yes, I understand that you are angry or that this is making you angry. I apologize for the delay. The doctor will soon be here. You still have to be calm. Professional demure, you have to be calm. Okay, you have to explain the importance of telling them you need to be checked by doctor so to be sure that nothing goes wrong, so you don't come back to the hospital anymore. Reassure the patient, that you are committed to addressing their concerns and you are following up to ensure their satisfaction. So I'm gonna give you some examples, scenario-based examples, questions and answers, with scenario. Maybe that will help. I don't know. I wouldn't know how they will twist or the story they will tell you, but I hope this gives you clue. Okay, now I will go with starting from the first one. For instance, you are assisting a patient with their meal. You notice they are having difficulty swallowing. What do you do? This is a scenario-based question. What do you do? So, for me, how I would answer that is, first of all, I will stop the patient from eating or drinking, to prevent any further discomfort or potential choking. Then I will check the patient's care plan for swallowing difficulty or dietary restriction. I would also ask the patient about their symptoms and reassure them that you are there to help. Okay, then if necessary, depending on the level of the choking, you would escalate the issue to the supervising nurse. Okay, so it's just when they ask you question, try and know where your role ends. Okay, know where your role ends. Don't answer question that you will tell them you will do this, you will do that. You are now crossing boundary of what you shouldn't do. That is why they paint all this scenario for us sometimes. You got another question I have here. A patient under your care is refusing to take their medication. How would you handle the situation? Okay, I used to say it. First of all, I will try to understand the reason behind the patient's refusal by asking open-ended question. I've said it before in my previous video. Open-ended question, allowing them, not using yes or no. You understand? The type of question that will allow that person to express themselves. Then you listen to them attentively with empathy. So you can understand the possible reason why they don't want to take the medication. It could be the side effect. It could be they're finding it difficult to swallow. It could be a lack of understanding on why they should take the medication. Just hear from them. It could be that after taking it, they are feeling dizzy. They don't want to take it anymore. Okay, so you have to understand why by listening to them and identifying their concern. Then after that, you will address it accordingly, by discussing with them. Okay, let me report what you have said to the doctor or to the nurse in charge, and for them to see maybe alternative way to administer medication to you. Then you pass on the information to whoever that should have it. Okay, so just know your job limit as a healthcare assistant. You are working with a patient who is feeling anxious about an upcoming procedure. Can you help them cope with their anxiety? How do you do that? How do you help somebody that is feeling anxiety? They are anxious about something. Maybe they want to go in for surgery, but they are anxious. How would you do that? So to do that, you have to focus on creating a very conducive and supporting environment for the patient. Listening to active listening is very, very important in this job. Okay, let them understand that, hey, your feelings are valid. They are valid. Your concerns are valid. I understand, but you reassure them, offer reassurance. Okay, just tell them step by step information about the procedure. It will help elevate the anxiety. Okay, so these things, they are just examples. These examples is to showcase your ability to respond to various scenario-based questions, for them to see your problem-solving skill. All they want to see is your problem-solving skill. Let's go back to what they said before. Remember, they tell you that they want to see, as a HCA, you're working in the hospital, they want to see your problem solving skill. When a patient is shouting at you, they doing this one, what skills would you do? What will you do? What will you tell them? What would you tell them? Remember, in everything, you have to remain calm. You have to reassure them. You have to also not go over your boundaries. Your job you should know your job limitations. Okay, you should know your job limitations. I wouldn't know what story or scenario they will paint for you, but I hope this helps. I hope it helps. I just have to, from my little experience, I was able to draft the questions I drafted. It could come from there, it may not. They may ask you something that is similar, but please, I need you to know that competency-based assessment, which is into two. Number one, the scenario-based assessment, where they said they will present two real world situations to the candidate. Maybe this thing has been happening, or there is possibility of it happening, or when it happened, what will you do? Okay, so first of all, they said the first one will prompt you to verbally outline the steps you would take. For you to outline a step, please use STAR method. Use STAR method. If you don't know what is STAR method, check on my HCA playlist and see where I thought about using STAR method to answer questions, where you have to put situation, task, actions, and results. Okay, that is what they want to know. They want to assess your problem solving and critical thinking. Like, how fast can you think? And even thinking that fast, what can you think out that will be positive to that situation that is facing you? Okay, the role play, where you have somebody that will act this scene, a patient swearing for you, shouting, saying they want to do this or do that. They will make you feel frustrated, as they are, because they want to be discharged. What do you do? How do you handle such situation? How do you handle it? They want to check how you can handle such situation, problem solving skills. Okay, I hope this helps. I am very, very busy. That's why I had to get all these videos to mesh them up and voice over it so it can help. Because if I said let me wait until when I'm off, this interview date will be over, and I don't know, maybe my video would help the person to maybe pass the interview or not. Yeah, so that is it. Please, if you sent me a message and I've not responded and you have an interview, I will be happy to do just what I've done for this person. Please resend me your message again. It is not easy for me. I have no I have limited time for myself, but I'm happy to do voiceover for you. Okay? Yeah. All the best and bye.